And we are back in English, guys, because sometimes I go in Spanish. And so today is a Tuesday. I'll keep our conversation. Today is Tuesday. And I want to talk to you guys about how December 15th, which is next Monday, is the deadline for you to get your health plan. Miss it and you're exposed. If you want real ACA, which means Affordable Care Act, health coverage starting January 1st, 2026, this is your last window. No extensions, no grace periods, no oops. Most people don't end up bankrupt because they didn't care. They go bankrupt because they thought they had time. Tonight, we're talking about the truth behind ACA plans, the part nobody explains until after the damage is done. So here's what let me break it down to you. Who is ACA? Who ACA plans are usually for? Why? What about the premiums? How to choose a plan? What happens if you miss the deadline of December 15th? How to avoid junk enrollments, your options if you're laid off, self-employed, or in a transition season. Because life doesn't care about timing. You'll also hear the blunt truths people need to hear. Just so you know, guys, health insurance is only useless on the days you don't need it. Being uninsured works great until it ruins your life. A zero premium with a 10K deductible is not a deal. It's a trap. Yeah, let me say this again. A zero premium with a 10K deductible is not a deal. It's a trap. The ER doesn't care why you missed the deadline. Good health is not a strategy. No plan is still a plan, just not a smart one. So if you're in Texas, Florida, or Ohio, this live stream is your warning and your lifeline. Like I said, hope is not a plan. Deadline don't care about excuses. December 15 is coming whether you're ready or not. So join me here so that we can talk about these things right about now. Okay? And again, maybe I'm having too much fun. But anyway, this is serious stuff. The reason that I care about this is because I've been living with health issues since I was in my 10s, my 10 years old and up. And I'm 51. So for 41 years, I've been dealing with different things in my life. And man, and it's expensive. Being sick is expensive. End up in the hospital is expensive. Even if you're not sick and something happens, you had some kind of accident, whatever it is not the best thing for you to do. So let me tell you what the ACA plan does for you, because it covers, it's private health insurance that covers preventative care, doctor's visits and specialist care, hospitalization, prescription drugs, mental health services, maternity care, emergency services, and more. So what makes it affordable? Most people qualify for income-based subsidies that significantly reduce monthly premiums and in many cases lower deductibles and copay too. Listen, guys, pay attention and do your own research when it comes to ACA, because both of the parties are using ACA to push their agendas. And so basically, the whole thing about the shutdown, that was the longest shutdown in the story of our nation, United States of America, was to do with the subsidies. But let me explain what happened. So when the ACA, the Affordable Care Act, was created, It only covered subsidies for people that were on the 100% poverty level. Then they kept extending those subsidies until they extended it to people from the 100% of poverty level income to 400% of poverty level income. And when the pandemic happened, they extended the subsidies to everybody. That is why those are the subsidies that are actually expiring, not the one for the people that need it. Okay, so I have to be very okay. So remember, we're fighting about the extended subsidies, not about the subsidies for the people that need it. By the way, I see somebody here that says an interesting thing is happening. My doctors are asking me if my insurance is in the ACA health plan before they book my next appointment. When I say I'm not in ACA health plan, then they book my next appointment. They don't have a right to ask you if it's in ACA or not. Why? Because they're going to get covered. Their private health insurance through the marketplace that have to cover certain things, including pre-existing conditions. Okay? But there's a lot of people that don't understand how these things work. So I'm going to show you right now how this works. And I am going to make a case of a person that is, I'm going to change this because I did a case later before. Most people have like 4 people. And let's say that they're 50,000. Let me just go. Let me see. Because if you don't make enough, you can be in ACA. You see? There you go. Let's see. 40,000. Then the person is 39. Okay. Is a tobacco user. And so you put your zip code, you put the county, you put your age and your sex, if you're a tobacco user, if you're a parent of a child, pregnant, blah, 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 okay? You're female, right? So let's say that she's pregnant. Look at this. They changed. This is a made-up person that I did. Okay, so now here is where I want to focus because people don't understand how these things work. And let me put it where I am not in the picture. There you go. You see this? Okay, there you go. Because, okay, so monthly premium is what you pay monthly, right? This is what you pay. Deductible is, look at this. What the health plan requires you to pay for healthcare each year before your health plan benefits kicks in. So this will be a bad plan if they didn't have the easy pricing, because the easy pricing basically gives you benefits before you reach your deductible. So let me show you this. So if you see this one here that doesn't have the easy pricing, it means that you'll have to pay $5,000 before your benefit kicks in. Here, you don't completely because you have the easy pricing. So out of these 2 specific plans, the one that is the best is this one, not this one. Okay? Then you keep going and looking. So if the person has more money, I could go like and say, hey, let me just put the lowest deductible. But you're going to see that the premium is going to go higher. You see? $530 a month, but you don't pay any deductible. So if you're a person that goes a lot to the doctor and you're in and out of the hospital, this will be better because you have no deductible and your out-of-pocket max is $2,200. Okay, your out-of-pocket is the most that you can spend in a year, not counting the premium. Okay, see? So it's the maximum, the most you'll have to pay within a year for healthcare services. Once you reach your out-of-pocket maximum, your plan begins to pay 100% of the allowed amount for cover in network essential health benefits. So if this person, sorry guys, give me a second. Okay. If this person is going to the doctor a lot, I will go for, let me see. And actually, let me put United Healthcare too, because United Healthcare and Blue Cross are the best. Okay, let's see this. Look at this. United Healthcare, $175. The deductible is $0. The out-of-pocket max $2,200. This is actually winning. Okay, also check what you pay. And look at the specialist visits is $10, and the doctor visits are no charge. No charge for genetic drugs. So if you are a person that is very, very sick and you're in and out of the hospital, this plan looks great. So look at this one. Zero deductible, zero drug test is $1,350. Doctor's visits 1, specialist visits 25%, and generic 2. So, this one is looking better. So that's a little bit of what I do to help you find a healthcare plan. If you guys have any questions, please let me know. And that code, this QR code that is up here, will take you directly to this page so that you can actually get a free quote. The quote takes 30 seconds, guys. 30 seconds, that's it. And like I said, guys, next Monday is the last day that you have, and let me show. Next Sunday, is the last day that you have. Monday, December 15th is the last day that you have to sign for a ACA plan so that you can start your being covered in January 1st. That means if you don't get signed by next Monday and you decide to sign on December 16th, you will not be covered on January 1st. You will start being covered in February 1st. So if you're a person that has a lot of health issues, you don't want to be without any cover. So scan on this link, go to there. If you're in Texas, Florida, Ohio, whatever you're at, doesn't matter. Go scan this code. But if you need my help and you're in Texas, Florida, Ohio, I can help you find the right plan for your family. And I will explain it very, very simply. Does anybody have any questions before I go? I see 2 people that are watching this live. What state are you in, and any questions? I can put a link here if you want to come up and ask me questions in the live. But please don't give any personal information while you're in the live. I can actually see if anybody's interested. I'll put this here. If you're in YouTube, you see the link. If you're in Facebook, you see the link. If you're in YouTube, you see the link. But it's important, guys, that you choose the right plan, because somebody that had another agent got screwed because that person signed this person in a horrible plan. And I said, you have to pay everything. You have to pay $10,000 something before you cover with anything. So you can actually have a zero premium, which is why you pay monthly. But if your deductible is $10,600 and there's no easy pricing, you are basically have a catastrophic plan. You're gonna pay up to your wazoo because you didn't know what you were doing and you didn't have somebody to help you. So if nobody has any questions, if nobody has any questions and anybody doesn't want to come up here, my information, let me put my info. If you need help and you're in Texas, Florida, or Ohio, is this. Where is it? Okay, yeah. Down here, and I don't know, let me put the English one, because hablo español. Si necesitan ayuda para un plan de salud, viven en Texas, Ohio, y Florida, I can help you guys. So, where is the English thingy? So basically it says for more info, it says in English and Spanish, yeah. And that's the phone, 512-387-2748. 512-387-2748. So I guess nobody has any questions about healthcare. And again, if you make less than $100,000 a year, you will pay mostly nothing for a plan. You will pay mostly nothing. Because again, it's not the premium that is the most important thing, it's the deductible. Okay, so I see you guys later. Please subscribe to my channel. I don't only deal with health plans. I do life insurance. I roll over 401ks, annuities into annuities. We deal with debt, helping people lower their debt, creating a trust where you can actually protect yourself from probate once somebody dies, all kinds of stuff. But right now I'm focusing on healthcare because ACA is open. The Affordable Care Act is open. Like I said, until January 15th. But if you want to be starting in January 1st, you have to sign by next Monday, December 15th, the latest. So anyway, remember that time passes and to prioritize yourself because no plan is still a plan, just not a smart one. And I want you guys to be protected because you never know when some kind of thing happens. Just so you know. I mean, just look at the news and you'll see. Because again, I'm healthy, I'll be fine. Not a plan. I'll deal with it later. Not a plan. That zero plan should be enough. Not a plan. So be smart. Take care of yourself. And I see you guys later. And subscribe, comment, and share. And this is Puerto Rican Insurance Queen, aka Mari Cruz, coming from the great state of Texas, United States. And you guys have a great, great, great rest of your week. And you got the QR code to go to the website. You got my information, my phone there if you want to call me in your Texas, Florida, Ohio. And I see you guys later. Take care.
Paper trails thicker than a mystery novel. Cash flow ripple make the banks grovel. Phoenix rise both shut with precision. Generational wealth, that's the mission. Legacy locked, key in the safe. Phoenix flying, no time to waste. Stacks on stacks, building the base. Future so bright, can't see the haze. Securities move, we the pros in the game. Trust airtight, playing no shame. Life insured, annuities grow. Seeds in the ground, now watch them show. Golden wings, soaring high.